Hi, my name is Mike Higdon with Mike Higdon Storytelling Studio. Today we're on the second episode of the Renown Rounds podcast, and we're talking to Melodie Osborn, the Chief Nursing Executive at Renown, and we're also talking to Sandeep Randhawa, the Chief People Officer at Renown. Today we're going to talk about the initiative that's part of the strategic plan that's going on for the next 5 to 10 years, and this initiative is about people first. So I'm going to have you to introduce yourselves and give a bigger bio so that people understand who you are now that they have your names.
Mike, thank you so much for the opportunity to come today and talk a little bit about our People First strategy. As you mentioned, I'm Melodie Osborn. I'm the Chief Nurse Executive. I've been a nurse for 23 years, and I've been at Renown now for, in July, it'll be 14 years, so excited to be here.
Well, thanks for having us again, Mike. And like my colleague, Sandeep Randhawa. I'm the Chief People Officer at Renown. I've actually been here a little less than 2 years, so fairly new to the organization, but I've been an HR leader probably for about 30 plus years now in the industry of healthcare.
Awesome. So I'm wondering who would be the best person to kind of launch a overall description of what the People First initiative is. Would it be you in HR, do you think?
I think either of us can do that because we're co-sponsors of the People First imperative, so I will leave it to my colleague here to maybe start us off, and then I can sort of enter in some thoughts around People First.
Awesome.
Well, I'm really excited about this initiative. As a nurse, we care for people. And so the fact that we are now embedding this into our strategic plan where we're really putting people first is really, really critical. I would just say that our overarching vision for a People First organization is really to ensure that our people have an environment where they can grow and where they can deliver the best care for our patients, for our communities, and where they really have an environment where they can thrive as clinicians and as employees. Sandeep, would you add anything else to that?
Yeah, I think the primary focus for us was, there's a lot of organizations out there in and outside of healthcare that will say that they are a people-first organization. And I think the challenge for us started a couple of years ago when we talked about what does that really mean to our workforce? How do we really live out what it means to be a people-first organization? And so we really gave it some thought. I think it started a lot with just listening to our workforce and our community and really figuring out what were the things that were important to people in order for us to really become a people-first organization and continue down that path.
Awesome. You talked about listening to your workforce. I'm really curious how you did that. Was it in kind of through official channels, or was it just through going through and interviewing people and your own experiences?
Yeah, I think it was on multiple levels. Quite honestly, as I was new to the organization coming in, I spent the first 6 months really just meeting lots of people, and not just leaders, but meeting lots of employees, rounding with folks, meeting many of our stakeholders, including our board members and community members and folks that were in our facilities, and really just listening to what made Renown a really special place to work and really offer some amazing services to our community. So I think part of it was a personal journey for me of just listening and learning. And then secondarily, I think it was important to collect really good information from our workforce, really talk to them and listen to them about what's most important to them when we talk about building out a people-first organization. And we spent countless hours, culminated in talking to over 400 employees and getting specific feedback. It's a small subsection of our workforce, but really a cross-section of people across our organization to learn as to what really mattered to them. And that's how we started the process. And from there, it really culminated into taking a deeper look into how we would go about creating a focus around people first so we could live out our mission and our vision and our values.
Awesome. So what are some of the things that really stood out to you during those interviews and conversations with the 400 employees?
Well, I think a few things. I think probably the predominant thing is that I think people choose Renown in our community because they see us as a healthcare organization where they can prosper and grow. They want to be proud to work for an organization that really contributes to the community in a very succinct way. We had quite a few employees tell us that their reason for choosing us first and foremost was the value proposition that Renown offered in terms of not just only on a total reward standpoint, but really quite honestly around a career development and progression standpoint. They really felt like Renown was a healthcare organization in the Reno community where they could come and learn and grow and advance their careers. And so that was something that was very apparent, and it still to this day is very apparent with the people that either enter the organization, and in some cases, when people leave, they give us that same feedback that they didn't maybe experience the level of advancement that they were looking for, right? So that's an opportunity for us. So that was one thing, I think. Another thing was just really listening to people and finding out how we can best serve our people, right? What are meaningful ways in which we can engage our staff, making sure that they're always having all the tools and resources that they need to be able to do their jobs and perform at their best. So those are just a few of the things that we learned. And I'll ask Melodie if there's some things that she may want to mention that we've listened to our employees and they've told us.
Yeah, absolutely. Coming out of the pandemic, one of the things that we heard loud and clear, obviously, was, our workforce. And, it's not unique to Renown, but we're struggling with workforce shortages across the organization. I think most organizations are feeling that. But one of the things that we heard from our employees is how do we help grow the next generation of healthcare workers? And so we have been working with our frontline teams. Just over the last year and a half, we have created new programs where someone who doesn't have healthcare experience can join the organization, get some fundamental basics, and then apply to enter into one of these workforce programs. So we have an echovascular tech training program. We just partnered with Great Basin College to launch a respiratory therapy training program. We have partnerships with different nursing schools throughout the community. We have a great partnership with the Orvis School of Nursing at the University of Nevada, Reno. We launched the Jerry Smith Academic Practice Partnership. So we have done so many things to help grow our workforce, and I think that that's really important to our employees. How are we helping to train the next generation of healthcare workers?
Yeah, I think our basic tenets really grew out of several key focus areas. One was really creating a work environment where people felt rooted in our values and they could really engage the work based on a really good understanding of our mission and our vision, and then demonstrating actions that really demonstrate our values. I think a second thing is really celebrating our diverse community, right? We serve a very diverse community, and so we need to make sure our workforce understands the diversity of services that we offer, the diversity of the work that's involved as we engage our patients in our community. Building data and infrastructure is also very, very important to us. And then cultivating partnerships is another area that we realized that we needed to continue down the road, as Melodie mentioned, not just with educational institutions, but other organizations, other non-for-profit organizations that also provide different aspects of healthcare, right? And then lastly, I think just making sure that we had a very good sort of a focused approach, right? So we don't want to be like all things to all people. It's really difficult to address every basic need that someone has. But I think by listening to our workforce, we were able to distill it down to 4 focused areas, right? One is around serving our people, as I mentioned before. The second is really helping people understand their value proposition if they come and really enjoy a career at Renown. The third thing was really how do they grow professionally? And that was really important and remains important to us. And our fourth area is really around what Melodie mentioned, which is continue that rigor around workforce development, because we're in this regional area where it's difficult to get people to either relocate to or to really understand what Reno's like. Quite honestly, a lot of people, when you tell them about jobs in Reno, they think it's Las Vegas, and it's nothing like Las Vegas. So,
Yeah, I'd heard that you might have an example personally of career development that Sandeep is describing in terms of how you grew up in Renown over the last 14 years.
Yeah, so when I joined Renown, I started as the director of nursing at Renown South Meadows, and then from there stepped into the chief nursing officer role for South Meadows and post-acute services. And I will say the opportunities that I have been given at Renown, I can't imagine that I would have had that opportunity really anywhere else. At Renown, we really have a unique opportunity to do a number of different things. We've started new programs that, like I said, in other organizations, we just may not have that opportunity. So this has been a great opportunity for me. I know I'm very grateful. I'm very grateful for the teams that we work with. Really, it's the employees that really drive me every single day, and they're the reason why I continue to stay here.
Do you have an example of what you kind of elucidated that Renown is sort of special in the sense that you don't think you could have those opportunities elsewhere? Why is that?
It's just growing new programs. Renown is a fast-paced organization, and the community really relies on Renown to deliver the highest quality of care. And so when we are looking to, how does Renown continue to grow, we're looking to the needs of the community. And so the ability, like I mentioned, to start new programs is really pretty unique, that in some organizations you may not have that opportunity. So for me, that was really important. And again, it's about the people. It's about the people. And I share stories with some of our board members. And I shared a great story today that our employees just go above and beyond every single day to make the experience of our patients really special and unique. I shared a great story today of our pediatric intensive care team. We had a young patient that had spent several months with us, very complex patient. They found out that while he was in the hospital, he was going to be celebrating his 16th birthday. And they all came together to learn, what was important to this patient, what were some of his wishes that he might have for his birthday. And they came together to create a very beautiful, special 16th birthday celebration for him. And you don't find that everywhere. And just, when you see our teams, going that extra mile for our patients, it's really so special. And again, that's the reason why I'm here.
Yeah, that's so true, Melody. In the short time that I've been with Renown, I've experienced so many different experiences where employees take it upon themselves to make that patient feel really special or that family member really special. And nobody's telling them to do so. That's the thing. That's the beauty of it. They recognize our culture. They recognize that their engagement solely lies on how they work each and every day to serve the needs of their patients. And I think you will hear many examples like the one that Melody just shared, where people go out of their way or above and beyond. And we have lots of great programs in which we recognize that. One that really comes to mind that I think is very unique to our culture is something called Everyday Amazing. And we provide recognition to employees where peers can provide recognitions, patients can provide recognition, and we do that on a day-to-day basis, right? And it's a great culture to sort of thrive in when you know that you are doing great things, but then people are recognizing you for it as well.
That's really cool. So I want to dig in more into how you build that culture, because I think that it's easy to have the high level thoughts about what you want to do. And the Everyday Amazing sounds like a great example, but how do you get like the day-to-day moments, especially in such a, I would imagine, stressful environment where sometimes you probably don't want to go the extra mile?
So we empower our frontline teams to help us kind of pull that information out. So we ask our frontline teams to just recognize each other when they find what we call a good catch. So if a mistake could happen, but we caught it before that mistake happened, we ask them to submit just a recognition. They send that to all of us. And then what we do as a leadership team is we actually schedule time with that individual to go up to the unit or department and actually thank them. And I had the opportunity to do that today with a nurse on one of our med-surg units who recognized that a patient needed to be in isolation, but the physician hadn't ordered it. And before placing that patient in a room that could potentially create, an infection in another space, she recognized that early and caught that and fixed it before we placed that patient in that room. And sometimes it's just the little things. And so we take it very personally, and we make sure that we go up to those departments and thank them for having those recognitions. And we do that every single day.
Yeah, I would just add, Mike, to say that storytelling is so powerful. And in our culture at Renown, I think storytelling goes way beyond just anything else that you would experience in results, right? Obviously, we need to focus on quality. We need to focus on our core, right? We describe that core as culture, operation, results, and engagement. And those are important to us to be able to service people in our community in the right way each and every time. But I think storytelling is so important because we celebrate the small wins. that patient that comes in with an acute or chronic disease or illness, and we are able to rehabilitate that person to where they can go home to their family. But then taking the time and pausing and just thinking about that experience and how our staff engaged with that family or that patient, and then sharing that with others, right? And that can be very, and forgive my pun, it can be very infectious, right? Like you get that out there in the culture, and everybody wants to be a part of that. And so I think that's what makes Renown really unique.
That is pretty cool. I think. Do you have like a way that you do internal storytelling? That's whether it's magazines or anything like that, or is it all kind of word of mouth?
No, we actually have quite a few tools. Outside of the formal tools, like we have daily newsletters and a lot of different written communications and celebrations and reward programs and things. I think the most powerful thing, though, that we share is what's called a mission moment. And I'll ask Melodie maybe to share, where that's been so powerful at times for us culturally.
Yeah, we actually started the mission moment process during COVID because, as you can imagine, COVID was a very challenging time for all of us, and we saw some really incredible stories, and it was just a time to just take a moment and breathe and recognize that throughout all of the chaos, some really incredible work was happening. So we started that at our senior leadership team, and now we have incorporated that into every single one of our meetings. And again, it's just a moment to really root yourself in your mission and your why, and just take a moment to recognize the incredible work that happens every single day.
Wow. That's really cool. I don't know a lot about, I guess, other companies or anything like that, but it seems like a pretty special thing that you guys are building to do that kind of work so that people know when they're recognized and, what makes them special also. So that's pretty awesome. One of the things that Dr. Erling said in episode 1 was really interesting. He said that some people had tried to, kind of twist the people first, like in kind of not a bad way, but just why can't I do X, Y, Z? Aren't you supposed to be people first? And he kind of was like, no, it needs to be good for everyone or the department. But we didn't get a chance to expand on that. I don't know if it's that something that you can reflect on, like what's the difference between what's good for me as an individual physician versus a good for the department or the hospital?
Yeah, I think that's a really important question. And as Sandeep mentioned earlier, we can't be everything to everyone. And so as we think about this people first strategy and this vision, it's really about what's good for the entire organization, not what's just good for me or good for Sandeep. It really has to be what's good for the entire organization.
I think the premise in which we become a true people-first organization really lies in our ability to be genuine and sincere in every interaction that we have with our workforce and our customers, right? Our patients, our community health partners. So the ability to avoid being disingenuous and just really being authentic, in the moment, and really sharing the good news, the not so good news, the things that we can do and the things we cannot do, I think is what makes a true people-first organization really thrive, right? Because then people really understand not only where we can excel, but what are some of our limitations as an organization. And I found through my experience that employees, if you have that level of transparency, I think people are more willing to work with you, particularly when times are hard. And I think that's why Renown, prior to my arrival, I think had such a great reputation of helping the community through COVID. I think the organization responded extremely well, better than most healthcare organizations, even 10 times the size, that had greater resources. But Renown was able to do something for the community that was truly unique, right, at that time. And I think that does stem from the early workings of having sort of that people-first culture and mindset is, okay, what are we going to do for our community to help them through this? And how do we all band together? And how do we stretch beyond our jobs that we have to really help the community? And I think that's what makes this culture really unique.
So it sounds like you guys have often, or maybe have always had this point of view. Why label it now instead of just keeping it going the way it was before?
I think that's an important question. You raised a really great question. I think there's too many organizations sometimes will use the sort of the verbiage or the mantra of being a people organization, right? I think for us, it was really, how do we put teeth behind it? Where people can observe, experience, learn, and truly understand what makes us a people-first organization. So I think spending the last, I would say, 12 months really cultivating a strategy that's very succinct to how we advance a people-first culture and mindset is crucial. Any other strategic imperative that we have only as good as the people that work that imperative, right? So we have to have a focus on our workforce, and it's super important to us. So I think developing tangible plans, developing mission, vision, and values. For example, we just worked with Dr. Erling and our organization to refresh our values. And one of the values that we added was people first. If we're going to be a people first organization, let's stand behind that value. We went one step further. We actually took our values and we defined specific actions that all of our employees can identify with, very specific actions they can all identify with and demonstrate on an everyday basis. That's the kind of rigor and effort that's needed to really advance a people-first mindset and culture.
Yeah, I would just add that without adding the teeth and the tactics behind the plan, the reality is that it's very difficult to deliver on your strategic plan without the people behind it. And so I think making that intentional call out is a game changer for us.
Yeah. And then recognizing we're not a perfect organization, nor will we ever be. However, you can always strive to meet people where they best need to be met, right? To be able to perform the jobs that we've hired them to do, making sure that they have the tools and the skills and the capabilities. And as Melodie said, you can't be all things to all people, but we surely can try to put together a culture that they can be really proud of. And that's what People First is really all about for us. And that's evident. We have examples of it. I mean, our best example is Culture Crew. We have a group of employees that meet every quarter, and they really talk about how we can strengthen and enhance our culture. And we take a lot of their recommendations and we put them in play in the organization. So that's a true example or a testament to our commitment to People First.
I would love to hear examples of these actions. I think that's actually new information for me to learn about, that you have specific examples of what people can do. Are you guys able to share those?
Yeah, absolutely.
Yeah, I talked a little bit about some of the workforce initiatives, and that continues to be one of our main tactics because, as I mentioned, we've got so many workforce shortages. So continuing to partner with different academic programs to develop new pipelines for clinicians. So we've talked about, the respiratory therapy training program. We're talking to another school to develop an accelerated nursing program here in our community. We're talking about how do we get high school students engaged in healthcare careers at a much earlier age. So that's just one example from workforce, but we're also looking at, how do we utilize technology to help augment the workforce? About a year and a half ago, we launched a virtual nursing program, not to replace nursing, but to help support our nurses at the bedside. So we have that up and running on 2 units. It has been very successful. There have been bumps along the way. So we're looking at, how do we continue to refine that program and potentially put that virtual nursing program in other units, again, to help support the nurses at the bedside. So those are just a couple of examples.
I mean, in addition to what Melodie just shared, which are extremely important, and they're a focal area of our efforts, we've also made sure that we have a strong career mobility program for our employees. And that's not about everybody wants to be a leader or get into a higher role of responsibility. It's about how do you transition people to different roles so they feel enriched, they feel like they're learning something, and sometimes it's a lateral position, right? But they're getting new skills that they're learning. They're developing new capabilities. So I think everybody feels good when they feel like they can grow in their jobs. So having a career mobility program is one that we're working on this year, will be very important to our strategy. I think another area that's important is making sure that we employ people in different ways, right? I mean, obviously COVID brought about an onslaught of remote working, telecommuting, et cetera, and we recognize that that is a mainstay of today's workforce, and how do we meet people where they want to work and how they want to work, right? And still making sure that those teams are productive, that they're still providing service to the organization and the community. And that's a challenge for us. So we are going to be looking at enhancing our e-learning capabilities, making sure that people have access to growth that's just beyond the traditional trainer classroom type of concept, right? Making sure that they understand where all the resources are and all the different educational programs that we have. Now, having said that, people want to grow with us into leadership positions. We have some amazing programs to help people develop and grow, from our Leadership Development Institute to our Leadership and Training, our High Potentials, where we can really focus in on the segment of the population that maybe are in individual contributor roles, but at some point they have a certain talent or skill, and we want to be able to help them grow. So that's a great program that people are in as well, and we run those programs consistently every quarter. There's lots of recognition, and we have examples of people moving up in the organization as a result of that.
That's really great. And I have a couple of questions, but I do want to backtrack slightly to the culture crew. If you could give just a really quick example of what the culture, like what does it look like for the culture crew to meet, not like tactically, but like what comes out of a culture crew meeting?
Yeah.
What's something that like they exit the room that they're in and do they hand a piece of paper to you that says we need to do this, or what happens with that group?
Yeah, that's great. So we have, let me kind of tell you a little bit about that, and then Melodie can probably expand on this. She has more experience with the culture crew. But really, for me, the culture crew is an amazing sounding board of our existing employees who can make sure that the things that we're introducing to our workforce are directionally correct, right? An example of it would be like rewards and recognition programs. Are they meaningful? Are they hitting the intended target? Are they hitting the audiences that we need to recognize and reward, right? That's an example. Interdepartmental cooperation or collaboration, right? The culture crew can help us also identify gaps where we're not working well, let's say within care teams, right? Across, whether it's a hospital or maybe from our ambulatory to our acute care spaces, right? We have a large catchment area where people work well across our region. So are there ways that we can be communicating better across teams, right? That's another great example. Just the most recent example that I can offer you that I think is very significant is that we took what we thought was, what was going to be our new mission, vision, and values that Dr. Erling may have spoken about on session one, and we took that to Culture Crew, and we explained how we came up with it and what the thought behind these values and our mission and our vision was. And they got an opportunity to not only provide feedback, but we incorporated their feedback, right, as an organization. Now, many organizations say that they listen to their employees, but that truly is an example of where we listened to our employees and we made the changes that we needed to make so we can publish our new mission, vision, and values in a way that people can really get behind it. So that's another great example of how we utilize Culture Crew. But Melodie, I don't know if you have other examples you want to share.
Yeah, I'll give you another great example. And Culture Crew was really a grassroots effort that was born, during the pandemic when we were struggling with, staffing challenges. And it was a group of employees that came together that said, this work is really meaningful to us. We're having some challenges. Would you be willing to sit down and talk through some of the challenges with us? And we said, absolutely. And through those conversations came a couple of frustrations with some policies that we had at the time. And they came together and made some recommendations for policy changes. And so from there, they continued to meet every quarter and talk about, what's working well, what's not working well, what recommendations do they have. And we've continued to take those recommendations because it's really, really valuable.
Awesome. Well, I have one last question for you guys, and it's I always like to do a little bit of a role play. So let's say I'm a person in the 8,000 employees who is whatever the position is, least connected to being on a computer, reading emails, things like that. But I'm still part of the team. How do I find out about all these programs that you guys are doing, and how do I feel included when I'm not even on like a nursing team, for example?
Well, you've hit a great example because majority of our employees aren't sitting behind a computer, right? They're at the bedside taking care of patients and dealing with lots of complex issues on a day in and day out basis. So they're not sitting there 8 hours a day responding to emails or phone calls. I think one of the things that we want to do, and we always want to ensure from a people first standpoint, is that the leadership teams that we have are out there and visible and rounding on our employees. That's extremely important to us. And that's really a great way to fill those gaps that sometimes employees have where they haven't heard anything, or haven't heard something firsthand, right? But now they get an opportunity where a leader's rounding with them, right? So that's really important. Another way that we do that is we have consistent town halls. As an example, our CEO at our largest hospital, Chris Nicholas, he does over 30 employee forums at different times, multiple times a year. We have about 80% of our staff that come to those forums because we make it such a big deal. Sam Weller, our CEO of South Meadows, does something very similar as well. So getting down to where you're having those grassroots discussions, sitting in front of employees, sharing information, being very transparent as to what's happening in the organization is another way that we keep people informed. But we have other ways, like our clinical employees, we have shared governance meetings, we have different councils for ancillary groups, different work committees and groups that they can go to and really cross-pollinate and talk about what's really important and how we deliver care to our patients and our community, what could be improved, like Melodie said, and what are things that are going well. So lots of opportunities. And then lastly, I would just say, we're pretty approachable leadership group, up to and including Dr. Erling. We get up in front of orientation, every 2 weeks, and we talk to our new employees, and we say, look, if you guys have continued questions, here's our emails. We're officed upstairs. Give us a call or shoot us an email. We're happy to answer any questions. So I think sort of cutting down that barrier, that formal barrier that sometimes exists between leadership and individual contributors, I think is key to our culture and just making people feel like, hey, look, we're real people, you're real people, we're here to do the same thing. How do we do it best together?
Mm-hmm. Well said. Well said.
So our time is almost up. Is there anything that either of you want to add that we haven't covered, or anything that you've been dying to say that I haven't asked about?
No, I just really appreciate the opportunity to come and talk about our People First strategy. As I mentioned, this is so important to our organization and to our community, and just appreciate the opportunity to share.
Awesome.
I love the fact that I've joined an organization that is putting their people first. I mean, in my 30 plus years, I've only dreamed about working for an organization that would put not only specific strategies, but would make it a big deal to always say, and Dr. Erling does this best out of all of us, every meeting, every function, he starts out by talking about people first, right? And that's the consistent message that our workforce hears. I love that. I'm passionate about it. I love the fact that, people come to us and Melodie and I as partners get to join in and educate them about what it means to be a people-first organization. And the journey's just started, to be honest with you, right? We started this journey about a year ago, formalizing this, and now we're getting to the point where the rubber is hitting the road. People are getting to experience some of the things that come out of being a people-first organization. That's really, really exciting to me. I would just say, Mike, the other thing that's exciting is I'm sitting at the National Automobile Museum. I'm a car guy. I see that there's new cars outside, and I need to get to go and see those cars. Melodie's a car girl as well. So.
Well, I don't know.
Yes, that's pretty exciting. And that's right, we're here. And we have another episode coming up after this. It'll be why is the not-for-profit mission important? And even digging into what that means for people who may think that it's a fancy way of saying nonprofit, which is not. So thank you both for coming in, and hopefully we can talk to you guys more and maybe a follow-up or find some other folks to express the People First mission later.
That would be great. Thank you so much for your time.
Yeah, Mike, thanks for having us. We really appreciate it. Thank you so much. And thanks to Melodie, it's my partner here.
Thank you.